Oltre naturalmente alle valutazioni di efficacia sono sempre più importanti le valutazioni in termini di sicurezza, soprattutto di sicurezza a lungo termine. Questo vale per tutti i farmaci, a maggior ragione per i farmaci biologici. Noi siamo qui all'Eular, al congresso europeo di Reumatologia, che però è diventato il congresso mondiale perché è quello più frequentato al mondo, e oggi sono stati presentati in anteprima i dati a 5 anni di un biologico che viene utilizzato per la terapia del lupus eritematoso sistemico. Stiamo parlando del belimumab e noi abbiamo il piacere di parlare col professore Ian Bruce della Università di Manchester per farci raccontare i dati di uno studio appunto che lui ha coordinato. Professor Bruce, which type of analysis did you perform for this biological product?
So this was an analysis of the long-term extension study where patients who had completed the clinical trial, the Bliss 52 and Bliss 76 trials, were then invited to continue in long-term treatment with belimumab, and our analysis focused on the accrual of damage and additional safety data in this population.
How many patients did you have analyzed?
So in the long-term extension study there were 998 patients that were recruited, and we followed these now out to 5 to 6 years, and so far there are about 403 patients who have reached the 5-year endpoint.
It's a good number for this type of disease?
This is a very large population which is recruited globally, including centres in North America, South America, and in the Far East and Europe as well. So a large global population which would be generalisable to most lupus studies.
Also, there were Italian patients?
Yes, so the European populations would have included patients from Italy.
Let's move to the results. You have analyzed the efficacy endpoint, such as the organ damages and also the safety data.
That's correct.
Let's start with the organ damages. What have you seen in this 5 years experience treatment with belimumab?
So in the 5-year extension study, we noted that the mean increase in the damage index over the 5 years was 0.19 points on the stick damage index, which is a relatively low accrual of damage in a lupus cohort. We also found that about 85% of patients overall had no new damage occurring over that period of time.
It's a trend in line with the usual trend with other drugs. It's a little bit better, a little bit worse.
So this is really the first study of long-term damage in a biological agent in lupus. To get comparative data to this, you have to look at historical cohort studies. And on average, at 5 years in inception cohorts and other lupus cohort studies, the increase in damage over a 5-year period would be about 0.4 to 1 actual SDI point. So that means that this suggests that the overall damage accrual in this population is lower than what you may expect, albeit we do not have a formal control group in this study.
Yes, very clear. Let's move to the safety data. Which type of analysis you have performed and which were the results?
So with the safety data we looked at treatment-associated adverse events, and the commonest adverse events that were noted were infections and gastrointestinal disorders, diarrhea, abdominal pain, etc. There were no new signals in the long-term extension study compared to what's already been reported in the phase 3 data and also in previous phase 2 studies. If you look at adverse events of special interest such as opportunistic infections, again there was no specific new signals related to any opportunistic infections.
Very good. How do you comment this data, and which is the relevance of these results?
So I think the relevance of this is that it does raise the hypothesis that if one uses more targeted therapies for the treatment of lupus, that if you get good long-term efficacy with that drug, then you may be able to reduce the accrual of damage, partly because you're controlling disease activity better, but also, and we know this from some other work that was done in the belimumab trial pooled populations, that overall steroid exposure may be reduced in patients treated with belimumab. So therefore, the combination of reducing the amount of steroid exposure and improving disease activity over time may help explain some of these results, and we need to formally look at that in more depth and confirm that. But certainly it would suggest that more targeted therapies may have a long-term beneficial effect in this population.